One of the most common things I see in newborns is difficulty nursing. And often it's not something the mom or the parent is doing, but an issue with the child. Today I saw a baby who was exhibiting something called reverse peristalsis, meaning their tongue was moving the wrong direction. When they were trying to nurse, the tongue was moving outward, essentially pushing out the mom's breast and pushing out the milk instead of moving this way to help suck and make suction. So this made nursing very inefficient, and the mom said it felt very pinchy as well. When babies struggle to transfer milk, we often see many clues. For example, it can be pain with nursing, there can be a clicking sound, there can be fussiness at the breast, or a baby that just seems very frustrated, or even a baby that seems to nurse a minute or two and be done. And here at Canopy Pediatrics, breastfeeding issues are not just things that are asked about or brushed off. We give them full attention. And myself, as a pediatrician, board-certified lactation consultant, and breastfeeding medicine doctor, this is something I can also assess, not just ask about. This means we look closely at several things as our assessment. First, we'll look at the baby's mouth. Does their tongue look normal? How is their palate? Do they have an upper lip tie? Do they have a lower tongue tie? And then we'll look at the mom's shape. Maybe she has a very flat nipple or even an inverted nipple that's not sticking out at all. Then I'll check the baby's suck mechanics. As I said earlier, is the baby's tongue moving the right way or is it moving the wrong way? Does the baby make sucking motions or do they just open and close their mouth, which can be very painful? And then also I'll check the baby's general musculoskeletal system. Some babies come out with tight necks, which is often called torticollis, or maybe their whole body's twisted. Often this manifests with babies who are good at nursing one side and not the other. And when we catch these things early, it can lead to a much successful breastfeeding experience. With these problems, it can lead to mastitis because of poor emptying of the breast. It can lead to damage and pain of the nipple because of biting. It can lead to poor weight gain because of the difficulty transferring milk. It can lead to many problems which can be prevented with early assessment of these issues. So depending on what's necessary, this can lead to referrals to specialists, such as those who do body work or people who do upper and lip tongue ties, which we do the upper and lip tongue ties here when necessary, or just close feeding and following and reassurance and helping mom get a better latch. So our goal here at Canopy Pediatrics is simple. We want a calm, happy, well-feeding baby and a confident, secure mother who is happy in her breastfeeding. If you're pregnant, if you're having a baby, if you're breastfeeding and things just aren't clicking, having a good breastfeeding assessment and training can make a world of difference. You don't have to struggle through this alone. Reach out to others who can help you.